Hi, my name's Jackie. I've been working as an occupational therapist with young children and families for almost 20 years. And in that time working with families, I've become really interested and passionate about the best ways that we can include parents in the therapy sessions that we offer young children with developmental delays. As part of that, I was awarded a Churchill Fellowship and also have recently completed my PhD in the area of how to strengthen and enrich parent-child interactions so that we can best meet a child's developmental goals. That we understand a lot more from looking at the research now is that a child's brain is way more lit up when they have the idea themselves in play. So an example of that is when they reach for the blue car themselves and push it along the table, lots more parts of their brain are lit up than when an adult gives them a blue car and asks them or shows them how to play with it. A relationship-based approach is where we focus on positive parent-child interactions in therapy sessions to help your child's development. So in a therapy session, rather than the therapist being the one who plays and interacts with your child, we'll ask you to sit on the floor with your little one and wait to see what they signal during their play, and then we'll work together with you, perhaps through the use of videoing your child playing, to work out what your child's signals mean and how to best respond to them to help your child develop to their full potential. So we involve parents in therapy sessions because we understand a lot more clearly now that when a young child is in sync with their parent, so that means when a child trusts that they can give their parent a signal and their parent can read that signal and respond to it, that's when a child does their best learning and their best developing. Often when a family comes to our service, they've got some very specific developmental goals that they'd like for their child, and commonly that's things like, I want my child to learn to walk or talk. What we find is that when we start as a first step with focusing on parent-child interactions and waiting for the child to show us signals, that builds a really good foundation for all of those other skills to be built upon. So an example of that is that when a little one is learning to talk, they first of all need to know that when I show a signal, someone notices that and responds. Similar to when we're having a conversation, when I say something, I'm trusting that someone's going to say something back after they've heard what I say. And often parents tell us that by focusing on the parent-child interactions and these play-based signals as the first step, once that became much more in sync between the parent and the child, other things like skills for walking or skills for talking started to come on board much more naturally anyway. And parents are often quite surprised that by focusing on parent-child interactions as a first step, they start to see gains in a whole lot of other areas as well. So we've used a relationship-focused approach for children with a wide range of diagnoses or developmental difficulties, and what we've found is that even for those little ones with very specific developmental needs because of their diagnosis, so for example a little one with cerebral palsy who may need very targeted intervention to support their motor skills development, that when we start with a relationship-focused approach, that helps build a much more solid foundation for some of those more targeted things to come on board. So an example is a little one who needs to be in a standing frame or may need orthotics. When the child and the parent are able to interact more smoothly and more in sync with each other, parents have said it's then much easier to put their little one into the standing frame or to put the orthotics onto their child, whereas before they'd done the relationship focused approach, those moments were causing a lot of tension and upset for both the child and the parent. So at Mamre we use a relationship-based approach because we've looked quite closely at the research literature in early childhood interventions, and a lot of the experts in early childhood intervention are saying that early intervention is a lot more effective, so children make gains more quickly or make more gains when we involve parents at the centre of everything that we do with or for their child.